Hi, Brad Condor here. Today I'm going to be talking about how people like to compare their back pain. And usually I like to tell people, like, don't compare your back pain for multiple reasons. And this is really kind of applies to all pain in general, just because a lot of times when you have pain, you're not really for sure what's going on. You're going to compare it to other people. You're going to ask them what they've been through. If you know they've had back pain, neck pain, shoulder pain. So a lot of times you want to talk to people that with similar feelings. But today I want to talk about some of the issues with doing that as far as comparing your back pain, because not every all back pain is the same. So there are some common misconceptions when it comes to back pain in general. Like, for example, that when you have back pain, you need to get an MRI. You need to actually find out what's going on. And MRIs have actually been shown not to really be real accurate as far as what's actually going on in your back. Because one of the things we know about MRIs is that when you, especially when you kind of have back pain, is that you can have something like a bulging disc and not really have any pain. And most people will have bulging disc and disc pathology over the course of their life, and we're starting to learn it's kind of can be some normal things. So that's one of the common misconceptions about back pain. And also, along those lines, when people have a bulging disc, it actually has a specific treatment from a doctor that we're expecting. Now, that's not always the truth as well, because everyone's back pain is different. And that's mostly what I want to talk about today is the fact that everyone's back pain is different, and it's okay to kind of have different signs and symptoms. The reason that's important is because when you do go to get treatment for this, it needs to be specific to your problem. I tell people all the time, when you come in to see me, I could have a bulging disc and back pain and no back pain, and you could have no bulging disc and a lot of back pain. So it's very, very different. What makes the difference as far as like your treatment goes, you need to get an actual physical exam, kind of see what your signs and symptoms are from your physical therapist or from your doctor, and make sure that correlates to what is actually going on with your life, and what we need to do to get that better. So that's some of the biggest things you want to kind of consider when you're going through a severe condition like back pain, is that not everybody's the same, and you want to make sure that you're getting someone that can actually evaluate what your course of treatment should be, because everyone's different. Like, when I have two people with the exact same symptoms, they could have the exact same kind of body frame, but their work is different. Their exercises and how to respond to it is different, and also what they need as far as the hands-on manual therapy is different too. So it's very confusing sometimes, and that's one of the reasons why back pain, I think, is one of the harder things to treat. Is because everybody thinks there's the same treatment out there, but actually in reality, all back pain is different. No matter what an MRI shows or what anybody tells you, all back pain is different. You need to be evaluated for your particular situation and given the correct plan of care to get to where you want to be. And also, another misconception is there's going to be a fix to your back pain. There's really no fixes. So when we learn what's going on in your particular situation, you need to also get a plan as far as how to manage this for the rest of your life. You can live pain free. You can be okay even with severe conditions as far as disc bulges, disc herniations, even surgeries. But you got to learn how to take care of your body. It's almost like a diet sometimes as far as taking back pain. You actually have to learn how to get it better from your therapist. Use therapy to get your pain down to a good level, and then figure out how to take care of it the rest of your life. So I know it can be scary to still take care of this type thing, and it's very confusing. I always recommend at least asking for advice from a therapist. You can talk to a therapist on the phone, like you can call us at 509-3136. We can talk on the phone about your situation, or you can look on the website, physicaltherapylouisville.com, for some free resources to learn more about your condition. Have a good day.